Good afternoon. I'm George Latimer, Westchester County Executive. It is Tuesday, October 4th, and we're here today at the Westchester County Department of Health Clinic on Court Street in White Plains, and I'm joined by Dr. Charlita Amler, who is our Commissioner of Health for Westchester County, and by Dr. Robert Baker, who is the chair of our Westchester County Board of Health. And both Dr. Amler and Dr. Baker and myself are here to emphasize the importance of being vaccinated as we now enter in the month of October into the season that leads us through the winter for two major issues. The one we've been talking about for the last 2.5 years, and that is fighting COVID-19, and the other one is influenza or the flu. In both of those cases, as we enter the colder months, we start to spend more time indoors. We make ourselves more vulnerable to the possibility of catching either of these two diseases. Now, we've talked a lot about COVID-19. We've gone through the presence of a vaccination appearing in early 21 and going through a two-shot initial program, and then booster shots now that have come along. And we have at this stage of the game, Dr. Amler will explain it in some greater detail, a new booster that is supposed to protect us better against some of the variants that we may find. And so this is a timely fashion for me personally. I have had 3 shots altogether, the original 2 shots, and then a booster shot that followed. This will be my 4th shot. Some folks are on a 5th shot already, depending on where they are in their own health. It is no secret that I'm over the age of 65, but I'm of generally good health, so we're trying to stay on the right side of that situation. Dr. Baker will also be taking his shot as well for COVID-19, and then we're taking what has become the annual flu shot, which we usually do this time of the year, and I'm sure between Dr. Baker and Dr. Amler, they'll both talk about the flu season that is at hand and the vulnerabilities that we all have. I think the important thing to understand is I am not the medical professional that they are. They spent their lives learning about what is proper medicine to keep people healthy. I'm a generalist, and my responsibility in government is to try to make sure that the health department and the other departments of county government have the resources of manpower and financial resources to provide benefits to all of Westchester residents. But there's a certain amount of this that comes on us as individuals. We have to take care of our health in our own hands. And I can confess, and if anybody can relate to it, then relate to it, that many times as a man growing up, I didn't do preventative things as I should have done. I sort of blew it off. I worried more if I had a physical injury that broke a bone than whether or not I was properly testing. I'm trying to lose some weight, as we all know and can see, and I'm also now very conscious, given my age, and of what's happening in the society, of the impact of both the flu and COVID-19. I've been here at other times to take a pneumonia shot and at some point a shingle shot. But all of these things are designed to give us a chance to have a better, healthy life if we take advantage of that opportunity. So let me ask Dr. Amler to speak a little bit, and then Dr. Baker will follow.
So thank you, County Executive. So I understand that with all the vaccines that people have been taking lately, that there is vaccine fatigue, but we still have to protect ourselves. Why? Because not just for our own well-being, our own health, but for the health of everyone that we love and care about, and the people that we are around, our families. And so right now we're coming into the time of year where we have historically, over the last few years, seen an increase in both COVID and historically the influenza. So usually we start seeing an increase in numbers right following Halloween, going into Thanksgiving, and then as we're around our families for the holidays, typically COVID numbers have gone up, and then we typically see a much larger bump right around Hanukkah, Christmas time. And so we're hoping that we can, prevent that from happening this year by reminding everybody that, one, we have a new bivalent COVID vaccine, which covers not only for the original Delta variant, but for Omicron, the Omicron variant as well. So that is available. Moderna, the Moderna bivalent for individuals over 18, Pfizer for individuals over 12. We also have our annual flu shot, and that's for anyone over the age of 6 months. And for individuals who are older than 65, we have high-dose flu vaccine that helps protect our older citizens like me from getting influenza. And so we just want to remind everybody, that it's that time of year. And also, I want to say that the health department has a pop-up flu clinic that's scheduled, and we will also be giving COVID-19. That's going to be at the Yonkers Riverfront Library this Thursday from 2 to 6 p.m. And you can go to westchestergov.com/health to book an appointment. Or you can go to our website, which is westchestergov.com/health, or call 995-9588 if you want to schedule an appointment sometime other than for this Thursday. When it comes to influenza, we typically look at the southern hemisphere to get some idea of what we think we will see going forward. This year in the southern hemisphere, their flu season actually started 2 months early and was one of the worst flu seasons that they have had in the last, I think, 5 years. They saw a lot of cases of influenza in children and teenagers. And so we don't know that this is what we'll see in the U.S., but typically we tend to follow what happens in the Western Hemisphere. So we are preparing for what could be potentially a bad flu season, and just want to remind everybody that it's time now, because you need a couple weeks after you get your flu shot before you have protection, just like a couple weeks after your COVID booster. And so now is the time, like I said, to get it before we get into Halloween and the other holidays that are going to follow. Let's see, I think that I've covered pretty much everything that I want to say, except that for children, again, any child over the age of 6 months is eligible to get a flu vaccine. And I think that pretty much covers it. So now I'm going to turn it over to Dr. Baker and hear from our Board of Health president. Thank you.
Thank you, Dr. Amler. She said, I'm Rob Baker. I'm the president of the Westchester County Board of Health. I'd like to focus on what's going on in England right now with COVID. Dr. Amler has pointed out again and again at the Westchester County Board of Health meetings that what happens in Great Britain seems to follow us into the New York region and Westchester about a month later. This past week, Dr. Lawrence Young, an internationally renowned professor of oncology and virology at Birmingham University in England, noted to the British newspaper The Independent that the winter wave of COVID is beginning there now, with new symptoms from the new immunologically evasive variants BA4, BA5, and BA2.12.1. The predominant symptom now is not fever or loss of smell, it's a sore throat. The point is to have a high index of suspicion with sore throats and give thought to self-testing if you get a sore throat. Also this past week in England, according to Politico, COVID cases have risen by 30%. The number of cases admitted in hospitals was up 50%. Hospital bed occupancy for COVID patients in England was up 37%. And 30% of UK hospital beds are now occupied by for COVID patients as opposed to with COVID patients. Historically, COVID deaths lagged the hospitalization rates by about 2 weeks, so stay tuned. Recall that with COVID being endemic in the U.S., the CDC is now using hospitalizations and deaths as the indicator for any change in the guidance. If the winter wave hitting England now reaches us in a little less than a month, it will be ill time for the heavily socially interactive time when we have Halloween parties. So we need to be careful. I would just want to reinforce the message, take this opportunity to get your bivalent COVID vaccine and flu vaccines as soon as possible, as Dr. Amler said, so they'll be primed in 2 weeks and ready for what hits us. Thank you.
Let me mention that those of us who have general government responsibility value the input that we get from our professionals on Dr. Amler's team, as well as our professionals in the Board of Health. Whatever types of general decisions that are made relative to masking and vaccination and so forth will follow whatever we see happen over the course of the next month or so. We've been fortunate over the last few months to have what I would consider to be relatively low numbers, under 10% hospitalization, under 10% infection rates, and our fatality rates over the last year have been 0.3%, which is encouraging. But we recognize that what both doctors have said is that we're entering a time of the year in which we are more vulnerable to these diseases than we have been otherwise. So we need to be flexible. I recognize myself that when I don't have to wear a mask, I don't, but I have to be prepared to change that behavior again should circumstances on the ground require that. And I ask you to do the same thing. Just do what's practical. We're not looking to impose philosophy on people, but we will deal with the pandemic depending on the direction that the pandemic takes. And we've had a relatively successful run of dealing with it, primarily because we keep that practicality in mind. Before we take the shots, let me ask a couple of very general questions. I guess I'll ask Dr. Amler to respond to it. So just from a layman's standpoint, I'm about to get both a flu shot and a COVID shot at the same time. That is okay to do from the standpoint of individuals.
Absolutely. There's no problem with getting both vaccines at the same time. And in fact, it's helpful because then you don't forget, oh, gee, I got my COVID shot, but I forgot to get my flu shot. And as I just said, we're getting into that time when both of these diseases are going to be ramping up in our communities, and you will be well protected for the holidays if you get them both right now. So I would strongly suggest go in, see your healthcare provider, call your nearest clinic, tell them you want the bivalent booster and you want your flu shot.
Now, as every time we've had COVID shot distribution, we are to wait here about 15 minutes so you can observe us to see if there's any reaction. Under normal circumstances, when I've had my past shots, I usually have stiffness in my arm over roughly a 24-hour period or so. Is that to be expected normally in these things?
Well, some people feel absolutely nothing. Some people may have a little redness or pain at the site, but it's nothing like getting the flu or getting COVID for sure. And so a lot of people have absolutely no side effects. So waits to be seen what you will experience, right, sir, but I hope that you have absolutely no side effects at all. But again, whatever the limited side effects you would have from either of these vaccines, they're nothing like the potential complications from influenza or COVID.
And the final question is there any prohibition of driving a motor vehicle or consuming alcohol in the period of time after taking these shots? What's your best advice and things like that?
You can absolutely just go back to business as usual, and whatever activities you would normally engage in, you can do. There's no restrictions from any of these.
I'm tempted to ask if that includes operating farm machinery, but I don't normally do that here in Westchester. So, well, with that, we appreciate your professionalism both. I guess Bob is going to join me in getting our shot.